A new report is revealing how older Americans are faring when it comes to their health over the past decade. Dr. Rhonda Randall with United Healthcare is here to break it all down. Dr. Randall, thanks for joining us this morning. Now, the report breaks it down state by state. So let's start with the positive. I'm a glass half full kind of guy. What are we doing well?
Well, this is the 10th edition of the America's Health Ranking Senior Report published by the United Health Foundation. It looks at 61 different measures of our health from multiple different data sources. And where we're doing well in the states of Kansas and Missouri this year overall ranked among the 50 states. Kansas came in number 27th. Missouri ranked number 42. There's a couple strengths in common. Both states have a low prevalence of excessive drinking among seniors. In Missouri in particular, you have a high number of home health care workers per capita and a low prevalence of severe housing problems for seniors. In Kansas, in addition, the number of older adults who avoided care due to high cost was low and in low prevalence of insufficient sleep. So seniors in Kansas are getting the recommended amount of sleep.
Well, at least somebody's getting the recommended amount of sleep. My goodness, I got to age up a little bit in order to get there. So let's switch it now and talk about maybe something we're not doing so well on.
In both states, we saw a high prevalence of low nursing home care residents. This means people who could have gotten care in a less restrictive setting, like their home or an assisted living, for example, with just some additional support. So that's something to look at, the community-based resources to support that. In Missouri, opportunities are high rates of physical distress among seniors and a high prevalence of smoking among seniors. And in Kansas, the areas where you can still improve, seniors have a higher rate of falls in the state and a need for more geriatric professionals, people who have degrees and additional training in caring for older adults.
Let's switch to nationally. What are some of the big takeaways from this report that are reflective over the entire country?
Yeah, and the good news front, we saw the highest flu vaccination rates that we've seen in the time we've been monitoring it for this report. One of the things that surprised me, seniors rated their own health status as very good or excellent, and that improved over the past several years. I was surprised to see that. But we really saw some concerning trends around mortality and mental health. Early death in the United States is up 17%. Of course, we know a lot of that was due to the pandemic, but there were other reasons as well. Among seniors, suicide rates increased 13% nationally, and drug deaths increased 100% during the period of time we've been measuring this report. There's some concerning trends also in mental health. Anxiety, depression, and seniors rating their own mental health as poor has increased.
All right, well, definitely some things that we need to work on, but there are some good and surprising statistics in there as well. Dr. Randall, we sure thank you for your time this morning. You can see more from United Healthcare at uhc.com.